Let's talk about what to do if your patient self-extubates. I actually got this idea from another nurse creator on here named Una, and so make sure you go check out her video. I will have it linked. And I really hope that's how you say your name. I'm so sorry if I mispronounced it. I've had, I think, one or two self-extubations on my watch, and I can talk about those in a separate video. But self-extubations happen. You can be the most diligent, careful, observant nurse, and stuff still happens. If you find yourself in a situation where your patient has taken out their breathing tube, let's talk about the next steps of what to do. First thing is I'm going to call for help if I walk in my room and notice my patient has extubated. I am then going to walk over to the IV pumps, and if that patient is on any sedation, I'm going to just shut that bad boy off because we do not want this patient to have their respiratory drive suppressed anymore. While I'm shutting off those pumps, I am going to attend to the patient to see what they need. Fun fact, the majority of patients that self-extubate are actually probably ready to be extubated. Not to say that that's for all cases, but in the majority of these cases, they actually don't require immediate reintubation. So I'm going to be looking at my patient and seeing what do they need. Can I just simply put a nasal cannula on them, or do they need me to manually bag them if they're not breathing adequately? Do we need to grab a vapotherm or a BiPAP? You're definitely going to want your respiratory friends in there. You should also be having someone notify the provider in case that patient needs emergently reintubated. So let's say this patient that self-extubated is not doing so hot. You couldn't just pop a nasal cannula on, call the provider, say, hey, this happened, so sorry, and they're doing fine. Let's say they self-extubate and they are not breathing well whatsoever. You're going to assist that patient in breathing until the provider gets there, and we are going to prepare to reintubate that patient. Now, because that patient self-extubated, there's most likely going to be some swelling and some damage in the larynx and on the vocal cords, which can make reintubation more difficult. And so we are going to plan on having a difficult intubation, even if it goes easy peasy lemon squeezy. Most hospitals should have a difficult airway cart or something that is readily available for these difficult airway situations. And so I'm going to make sure that somebody has grabbed that to have it available. Once we have reintubated that patient safely and all is well in the world, I'm going to look at, okay, how can we prevent this from happening again? I'm also going to write an incident report on the event that happened to just document it for documentation purposes. And just remember, you can be the bestest nurse in the entire world, and self-extubations, they happen sometimes. We're busy. We have to watch more than one patient, and you can have patients restrained in mitts, and they still can manage to wiggle down and grab their breathing tube in like 2 seconds. And one last thing, if your patient self-extubates and they're doing okay, make sure that you evaluate their swallowing before they do any PO intake. Get your speech therapist involved, because there's probably going to be some difficulty in swallowing that can put your patient more at risk for aspiration.